January is Cervical Cancer Awareness Month, a time when issues related to cervical cancer, HPV disease, and the importance of early detection are discussed across the country. Joining us to give us more information is Dr. Pari Ghodsi, a board-certified gynecologist who's passionate about young women's health and bringing awareness to topics that promote safety and self-awareness. Dr. Pari, thanks for being with us.
Thank you for having me today.
Okay, so first of all, cervical cancer isn't one of the cancers that often makes headlines. What are some of the things that we need to be aware of?
Well, I think that first of all, it's important to know why it doesn't make headlines. And I think it's because we have done such a great job with lessening the amount of people that get cervical cancer a year. It has actually decreased by 50% in the past 30 years just because of pap smears alone. And that's kind of the number one thing that you need to know, is that the best way to prevent cervical cancer is to have your regular pap smear. That is the screening that's most important.
How many women a year would you say are affected by cervical cancer?
Well, we know there are about 12,000 cases usually a year of cervical cancer, and 4,000 people actually die. And the reason is because we do have a really good job of screening and prevention prior, but once you get to that point where you have cervical cancer, unfortunately, it can be a pretty deadly disease.
Talk a little bit about the vaccines out there that can help prevent cervical cancer.
So this is another one of the really important facts about it, is that the majority of cervical cancer and abnormal pap smears that lead to cervical cancer are caused by HPV virus. HPV is human papilloma virus, and it is a sexually transmitted virus, and there are hundreds of strains of it. There are 13 that can lead to cervical cancer and abnormal pap smears. So luckily, there are vaccinations on the market that can prevent against the certain types of HPV that could lead to cervical cancer.
Now, many parents, especially Christian parents, are opposed to the HPV vaccine because they feel like it's basically giving consent for their kids to have sex. What would you say to this?
I think this is a really common concern among parents, Christian parents, and parents of different religions too, is, are we introducing the idea of sex too early by bringing in this vaccine? And I think it's just important to realize that HPV is something that is endemic in our population. 80% of the population will come in contact with HPV at some point, and it is usually sexually transmitted. With that said, you don't have to be high risk or promiscuous or have sex at a young age or any of these things. It's just at some point you would have to have sexual contact in your lifetime to usually be exposed to it. And I think that it's really important that actually if your child, because it is approved, the vaccines that are out are approved from ages 12 to 26, if they get it early on in their life, then they are actually preventing a lifetime protection. There's no booster that's needed. And so it's actually a great thing to do much prior to sexual intercourse even starts.
Why is it so important to reach millennial-aged women with this message?
It's most important to reach them because, first of all, it's very endemic in our population. It's 80% of the population as stated, but most importantly, the majority of people that are getting HPV, that are having their first exposures, and that where we see it's most common is in early 20s up until, the age of 30, even into late teens starting, and then through your 20s. So, this is the population that's getting most exposed. It's the population that is getting introduced to sexual intercourse, and that has the highest risk of exposure. And, it is something to think about, to always protect yourself against any STD, as well as obviously pregnancy. And if you think about it, this vaccine is the only vaccination on the market that can protect you against a sexually transmitted disease that could potentially lead to cancer. And it's a lifetime benefit. So if you get it early on in these age groups before you start having intercourse, it will protect you for an entire lifetime. The good news is that we know that even if you are exposed and you are exposed early on in life in your 20s, you are actually more likely to clear it than older people. But again, it's so much more common. And so that's why the awareness really has to be there.
Dr. Pari, thanks for being with us. You can go to her website at www.drpari.com.